Assalamu alaikum. I'll be talking about rectum today. This rectum, it is the part of the large intestine which is present in the lesser pelvis. The word rectum is derived from the word rectus, which means straight. But this rectum, it is not at all straight. It is curved. It has various curvatures. As you know, the rectum is the distal part of the your large intestine, which is present between your sigmoid colon. It is present between your sigmoid colon and anal canal. This is your sigmoid colon and this is your anal canal. Your rectum is present between the sigmoid colon and the anal canal. It extends from the rectosigmoid junction. It extends from the rectosigmoid junction to the anorectal junction. To the anorectal junction. This is your rectum. Then where is it placed? As you can see, this rectum is placed in the lesser pelvis. This is your lesser pelvis. It is placed with other pelvic organs like bladder, uterus, and you have this rectum. It is present in the lesser pelvis. Posteriorly, it has lower three sacral vertebra. These are the lower three sacral vertebra. These are the lower three sacral vertebra, and this is your rectum. These are the lower three sacral vertebrae, and this is your rectum. Then for the extent, it extends from the rectosigmoid junction to the anorectal junction. Rectosigmoid junction, that is the junction between the sigmoid colon and the rectum, to the junction between the rectum and the anal canal. From the rectosigmoid junction to the anorectal junction. This was the extent. Then its dimensions. Your rectum is 12 centimeters long. It is 12 centimeters long, wide 4 centimeters wide, but near its lower end it is dilated. This dilated part here is called as the ampulla. This dilated part here is called as the ampulla. See the picture. Again you can see here, this is your rectum, this is your sigmoid colon, this is your rectosigmoid junction, this is your anorectal junction, and this is your anus. Fine. And posteriorly you can see the lower three sacral vertebrae. You can see the lower three sacral vertebrae, and this rectum is present anterior to the sacrum, and here you have this coccyx. Coccyx is another bone which is present below your this sacrum. This is your coccyx. It is present 2 centimeters in front of the coccyx. It is present 2 centimeters in front of the coccyx. This was the we mentioned the situation. Situation means where it is placed. It is placed in front in the lesser pelvis. It is placed in the lesser pelvis in front of the lower three sacral vertebrae. Then the extend. कहाँ से कहाँ तक की है? It extends from the rectosigmoid junction to the anorectal junction. Then the dimensions, I told you it is 12 centimeters long. The width the width is 4 centimeters, but lower down you have a dilated area that is called as the ampulla. Here the width is more. Here the width is more. After that, come to your next slide. See, talking about the course and direction of the rectum. See, it is not at all having a straight course. There is no straight course for the rectum. I just want to tell you how is rectum different from rest of the large intestine. As you know, the rest of the large intestine, it has certain features, like you have appendices, epiploiky, you have saculations, and you have tinea coli. All three are absent in your rectum. All three are absent in your rectum. For the course, see this first pic. In the first pic, as you can see, the rectum is downwards and backwards, है ना, पीछे की तरफ. अगर ये anterior है यहाँ से, I will show you. If this is anterior here and this is posterior, so rectum in the upper part is downwards but backwards, downwards but backwards. In the middle part it is downwards, and in the lower part it is forwards and downwards. ऊपर वाले part में backwards and downwards, बीच वाले part में downwards, lower down, forwards and downwards. ठीक है, this is the direction of the rectum. Then for the curvatures, as I have told you that rectum is not at all straight, it has various curvatures. It has two antero-posterior curvatures. These are the antero-posterior curvatures. One is this is your sacral curvature. Can you see? This is your sacral curvature. Is sacral curvature, how is it formed? You have the lower down, you have three lower sacral vertebral bodies behind your rectum. Then in the concavity of them, the rectum obtains this sacral curvature. In order to adjust in the concavity of the sacrum, the rectum gets this sacral curvature. Then you have another, that is the perineal curvature. This is present at the anorectal junction. This is present at the anorectal junction, this perineal curvature. See. After that comes your these were antero-posterior curves. You have three lateral curves also. Upper lateral curvature towards the convexity towards the right, middle lateral curvature convexity towards the left, and lower lateral curvature convexity again towards the right. These were the curvatures and course of the rectum. Then see, for the peritoneal, now the relations. You have peritoneal relations and you have the visceral relations. This is the rectum. Fine. You can see in the upper part, it is covered on the peritoneum on all sides. See the section. I have taken the section of it. This is the upper part of the 1/3 of the rectum. Peritoneum is present anteriorly and laterally also. आगे से भी है और laterally भी है. Then for the middle 1/3 of the rectum, peritoneum is only present anteriorly. And lower down, there is no peritoneum, and in the lower 1/3 part there is no peritoneum. Again, see the close-up of the picture. Upper part 1/3 of the rectum, the peritoneum is present anteriorly and the lateral ways also. Then for the middle 1/3, peritoneum is present anteriorly. Lower 1/3, no peritoneum. This lower 1/3 part, ये जो होता है ना ये part, it is present. I will show you one pic. लोअर 1/3 पार्ट, ये वाला पार्ट है, इट इज़ प्रेजेंट. यहाँ पे ये होता है रेक्टो यूट्राइन, है ना यूट्रस, ये फीमेल की बॉडी है. यहाँ पे होता है रेक्टो यूट्राइन पाउच, यहाँ पे होता है रेक्टो यूट्राइन पाउच, रेक्टम और यूट्रस के बीच का पाउच, दैट इज द रेक्टो यूट्राइन पाउच. दिस लोअर पार्ट इज प्रेजेंट बिलो दिस पाउच. ठीक है. इफ इट वुड हैव बीन अ मेल, यहाँ पे मेल अगर होता तो यूट्रस विल बी एब्सेंट. देन यू हैव रेक्टो वेजाइकल, वेजाइकल मीन्स ब्लैडर, रेक्टो वेजाइकल पाउच. और ये जो लोअर 1/3 ऑफ द रेक्टम है, it would have been present below the rectovesical pouch in case of males and rectouterine pouch in case of females. Then for the visceral relations, ये हम बोल रहे थे पेरिटोनियम के साथ क्या रिलेशन है रेक्टम की. हमने बोला अपर 1/3 में it is present anteriorly and on the lateral side also, but in the middle part only anteriorly, and lower 1/3 is devoid of peritoneum. Then for the visceral relations, in case of males में क्या होगा anteriorly? Anteriorly in the upper 2/3 you have rectovesical pouch, what I have told you. This is rectum. ठीक है. यहाँ पे होगा इसको रेक्टोवेजाइकल पाउच, ये है रेक्टोवेजाइकल पाउच. दिस इज द रेक्टोवेजाइकल पाउच. This I am talking about the anterior relations in case of male. Anterior in case of male and females are different since the organs are different anteriorly, and the posterior relations will be same in both the sexes. See the relation here. Anteriorly you will be having the rectovesical pouch, a pouch between the rectum and the urinary bladder. ये होगा आगे rectum के. और क्या होगा? You will be having the sigmoid colon, you will be having the sigmoid colon, and you will be having the coils of intestine, and you will be having the coils of intestine. ये सारी होगी upper part, ये rectum के ऊपर वाले हिस्से के आगे होंगे ये तीनों स्ट्रक्चर्स रिलेशन में, रेक्टोवेजाइकल पाउच, सिग्मोइड कोलन एंड कॉइल्स ऑफ इंटेस्टाइन्स। नीचे वाले पार्ट के रिलेशन में क्या क्या आएगा? दिस इज seminal vesicle. This green colored, this is your seminal vesicle. Then you have this prostate, urinary bladder के चीज नीचे एक accessory sexual organ होता है मेल का, this is called as the prostate. You have seminal vesicle, you have prostate, and you have ductus deferens. You have ductus deferens. Again I will be talking about the relations. देखिए बेटा, in the upper part of the rectum anteriorly, in case of males, you will be having the rectovesical pouch, a pouch between the rectum and the urinary bladder, then the sigmoid colon and the coils of the intestines. Lower down anteriorly, you will be having the bladder, you will be having the prostate, seminal vesicles and ductus deferens. Fine. Then in case of females, what in case of females? Anteriorly in the upper 2/3 you will be having the rectouterine pouch. ये है आपका rectum, ये है uterus, ठीक है, ये है यूट्रस. यहाँ पे आपका होगा rectouterine pouch, a pouch between the rectum and the uterus. You will be having the rectouterine pouch. यहाँ पे होगे sigmoid colon and the coils of the intestine, ठीक है. And lower 1/3 anteriorly you will be having the vagina. You will be having the vagina. It is related to the vagina. Again, in case of females, the anterior relations of the rectum, this red colored is your rectum and this is your uterus. Anteriorly, you will be having in the upper 2/3 rectouterine pouch, a pouch between the rectum and the uterus. ये और यहाँ पे होगी sigmoid colon and the coils of the intestines. Lower part of the rectum has the relations as यहाँ पे होगा vagina. You will be having the vagina here. Then for the posterior relations, this is the diagram which will depict the posterior relations of the rectum. ये देखिए ये section आप अच्छी तरह से, this section, as you can see, this is the transverse section, this is the rectum, this is the lumen of the rectum, और जिसमें लिखा है this is the lumen of the rectum. Then the posteriorly you have the, first of all you will be having the sacrum, है ना, sacrum होगी ना पीछे से और होगी coccyx. यहाँ पे भी आप देखो sacrum होगी पीछे से और होगी coccyx. यहाँ पे आगे क्या होगा? rectum. इस सब के आगे rectum होगा. ये sacrum है, ये coccyx है और इसके आगे होगा rectum. और क्या होगा rectum के पीछे? You will be having this muscle, it is called as the piriformis. Then you have another muscle coccyx के पास, that is called as the coccygeus, and one more muscle that is called as the levator ani. ठीक है, you have these three muscles. पहले आपको क्या होगा rectum के पीछे? ये सब है ना, what you can see in this diagram. This is the sacrum and the coccyx. In front of this you will be having your rectum. अब यहाँ पे मैंने rectum को हटाया, तो what structures you will come across? Posteriorly the sacrum and the coccyx हो गया एक चीज़, और एनोकॉक्सिजियल लिगमेंट. एनोकॉक्सिजियल लिगमेंट, एनस और कॉक्सिक्स के बीच में यहाँ पे एक लिगमेंट होता है, उसको हम बोलते हैं एनोकॉक्सिजियल लिगमेंट, ठीक है. उसके बाद ये मसल पायरिफॉर्मिस, देन यू हैव कॉक्सिजियस एंड द लेवेटर एनाई. दीज आर द मसल्स. दिस इज द सिंपैथेटिक चेन. ये चेन एक आती है ऊपर से, दिस इज द सिंपैथेटिक चेन. ये भी होगी पोस्टीरियर रिलेशन में. यू हैव लेटरल सेक्रल आर्टरी, यू हैव सेक्रल plexus of nerves, and you will be having the median sacral artery. और आपके पास ओके यहाँ पे होगा यही गैंग्लियोनिक इम्पार. ये है गैंग्लियोनिक इम्पार. Fine. What are the and lymphatics and the fat, of course. Again for the posterior relations of the sacrum, see the picture keenly. What you will come across, first of all you will be having the sacrum posteriorly, then the coccyx और coccyx और anus के बीच में you will be having the anococcygeal ligament here. Then the muscles piriformis, coccygeus muscle, levator ani muscle, median sacral artery, lateral sacral artery, sacral plexus, और यहाँ से होगी दोनों साइड से सिंपैथेटिक चेन, ये माला जैसी, और यहाँ पे गैंग्लियन इम्पार. ठीक है. Then lymphatics and fat, of course. These were the relations, posterior relations of the sacrum. See this diagram again keenly. See the things what you can observe. You can see this is the rectum, this is the lumen of the rectum. Then you have this piriformis, sympathetic chain, medial sacral artery, sacrum पीछे से. This is the transverse section. Then You have certain mucosal folds in the rectum. You have certain mucosal folds in the rectum. In the rectum, you have longitudinal and transverse mucosal fold. In the rectum, you have longitudinal and transverse mucosal folds. ये folds होते क्या है? Longitudinal folds अंदर से mucosa में होते हैं, but during distension, because of the fecal matter, these folds go away. They are obliterated, so they are not the permanent folds and not of much importance. Then you have these transverse folds. ये आपको दिख रहे हैं ये transverse folds. ये transverse folds, they are permanent. They don't get obliterated. ठीक है? You have 4 transverse folds. One is missing in this diagram. One is here. You have a transverse fold on the right side, first transverse fold, which is 12 centimeters above the anal canal. यहाँ पे आपको rectum के पास पहला transverse fold होता है, which is 12 centimeters above the anal canal. Then on the left side you have another fold, another transverse fold, which is 7.5 centimeters above the anal canal. This second fold can even constrict this lumen. It can even constrict this lumen. Then you have third fold, which is again on the right side. It is a constant largest fold, transverse fold, and then after that you have the lowermost transverse fold on the left side. It is again not that important. Then again I will repeat, first fold here 10 to 12 centimeters above the anal canal. Second fold, it is 7.5 centimeters above the anal canal, and it has tendency to constrict the lumen. Third, the largest, it is the largest one, and it is the most constant one. Then you have the lowermost. This is most inconspicuous. This is not important. These folds, these transverse folds, these are called as plica transversalis or Hostan's valves. They are called as the plica transversalis or Hostan's valves. Then functional parts of the your rectum. Functional parts means जो आपका third है ना ये transverse fold. This your third transverse fold. Your third transverse fold. I will show you the previous pic. Your third transverse fold. Up to this place, your rectum is being developed from hindgut. Up to this place, your rectum is developed from hindgut, and lower part is developed from the cloaca. For the blood supply of the rectum, which is very important, you all must go through it very keenly. This is your aorta. This is your main vessel of the abdomen, that is the aorta. इससे आती है एक inferior mesenteric artery. Inferior mesenteric artery. Inferior mesenteric artery gives a branch called as the superior rectal artery, which supplies the rectum. It supplies the rectum. ठीक है, it supplies the rectum. ये है आपकी aorta. इससे आती है inferior mesenteric artery, which gives a branch in the form of this superior rectal artery. Lower down, in front of the lower 3 sacral vertebrae, this superior rectal artery, it branches. ये बहुत सारे branches देती है. It branches up to the anal valves. Anal जो canal होता है वहाँ पे valves जैसे होते हैं, and it forms the loops there. It forms the anastomosis there, loops there. क्या हो जाता है? See the blood supply of the rectum once more. This is your aorta. Branch gives it as inferior mesenteric artery. Inferior mesenteric artery in turn gives another branch, that is the superior rectal artery, which further gives small branches which form the looped anastomosis in the anal valves. ठीक है? Then another source of blood supply is the middle rectal artery. Can you see somewhere middle rectal artery? Yeah, no. I think it is in the, yeah, this is your middle rectal artery. This is your middle rectal artery. This is your middle rectal artery. This middle rectal artery, it comes from the internal iliac. जो आपका है ना aorta, इसका ये होता है common iliac दोनों साइड से. ठीक है, इसके 2 common iliac arteries बनती है, right and left. ठीक है, right and left. जो अब ये common iliac है, इसका निकलता है external iliac और internal iliac. इसकी निकलती है external iliac. See, this is the right external iliac and this is the right internal iliac. This is the right external iliac and internal iliac. इस internal iliac से आपकी निकलती है middle rectal artery. इस internal iliac से आपकी निकलती है middle rectal artery. Again, This is aorta again, divided into two common iliac arteries, right and left. Left वाली की निकलती है right external iliac and left external iliac. Right external iliac, left external iliac, which in turn gives the right internal iliac gives the right middle rectal artery, and it supplies the external musculature of the rectum. ये कैसे जाती है rectum के पास? यहाँ पे होता है एक rectum के side में एक ligament that is called as the lateral ligament of the rectum. Lateral ligament of the rectum. उसी के through ये जाती है rectum के पास. Then you have one more blood supply to the rectum, that is the median sacral artery. This median sacral artery, this is the branch of the aorta. ये aorta के पीछे से निकलती है, ठीक है, ये aorta के पीछे से निकलती है, and it supplies the anorectal junction. एनस और रेक्टम के जंक्शन को ये सप्लाई करती है, दिस मीडियन सैक्रल. यू हैव द ब्लड सप्लाई फ्रॉम द सुपीरियर रेक्टल आर्टरी, मीडियन सैक्रल आर्टरी एंड middle rectal artery. These are the sources of blood arterial supply. Then for the venous drainage. Venous drainage अब कैसे होगा? यहाँ पे जो आपका ये रेक्टम है ना, यहाँ पे होता है इंटरनल वेनस प्लेक्सस, ठीक है, ये प्लेक्सस आप देख रहे हो, इंटरनल वेनस प्लेक्सस. ये इंटरनल वेनस प्लेक्सस क्या करता है? ये वेन्स बनाता है, 3 वेन्स बनाता है, ऊपर जाके 1 2 3 बनाता है, 3 वेन्स जो मर्ज करके बनाती है सुपीरियर रेक्टल आर्टरी, जो मर्ज करते बनाती है सुपीरियर रेक्टल वेन, एंड दे ड्रेन इनटू द इंफीरियर मेसेंट्रिक वेन. For the venous drainage, you have this internal venous plexus in the anal canal, which merges to form the 3 veins. They form the superior, they in turn unite to form the superior rectal vein, and that drains into the inferior mesenteric vein. Moreover, you have the middle rectal vein. See, कहाँ गई? हाँ, this is your middle rectal vein. It again drains the musculature of the rectum and enters the internal iliac veins. यहाँ पे होती है आपकी internal iliac veins, उसमें जाती है. Then you have the median sacral vein somewhere here, median sacral vein, that takes the drains the blood into the your common iliac vein, that drains the blood into the common iliac vein. Again for the veins, you have the superior rectal vein, middle rectal vein, median sacral vein, which drains the blood into the common iliac vein. Fine. Then for the lymphatics, your upper part of the rectum, more than half of the upper part of the rectum drains along the superior rectal vessels, into the inferior mesenteric nodes, into the inferior mesenteric lymph nodes, and lower part of the rectum that drains into the internal iliac lymph nodes, and these move along the moves along the middle rectal vessels. They move along the middle. Lymphatics from lower half pass along the middle rectal vessels and drain into the internal iliac nodes. Upper part drains into the inferior mesenteric nodes along the superior rectal vessels, and lower part drains into the internal iliac nodes, and lowermost drains into the inguinal nodes. Then for the nerve supply is in the form of sympathetic and the parasympathetic. This is the sympathetic comes from the L1 and L2, and parasympathetic comes from the S2, S3 and S4. This is the sympathetic chain. These are the S2, S3 and S4. These parasympathetic gives the sensation of distension, while as both sympathetic and parasympathetic gives the sensation of pain. Fine. Parasympathetic gives sensation of distension as well as pain, and sympathetic gives sensation of pain. Then the sympathetic is vasoconstrictor and motor to internal sphincter. Sympathetic जो होता है वो vasoconstrictor होता है and motor to internal sphincter, whereas parasympathetic is not vasoconstrictor, it is inhibitory to sphincter, but it helps in the motor to the, it is musculature को ये होता है ना, musculature जो होता है ना उसको supply करता है. It is excitatory to the rectal musculature. If we compare the two, see, this is the sympathetic chain. These are the pelvic S2, S3 and S4, which are the parasympathetic element. Sympathetic chain is the sympathetic element. sympathetic this comes from the L1 and L2, and parasympathetic comes from the S2, S3 and S4. Sympathetic helps sympathetic जो होता है ना, it is vasomotor and excitatory to the sphincters, whereas parasympathetic is excitatory to the musculature. इतना आप याद रखो, this much is sufficient for you. Then comes your supports of rectum. अब supports of rectum में क्या क्या होता है? Supports of rectum पहले ही होता है pelvic floor. ये हो गया आपका pelvic floor. ये है ना rectum, इसको नीचे से support करके है क्या? This is your pelvic floor. ये pelvic floor किससे बनता है? यहाँ पे आपकी muscles होती है दो, ये हो गई यहाँ से और ये यहाँ से levator ani muscle. This is your pelvic floor. Then you have the perineal body. एक चीज़ होता है जो आप आगे पढ़ोगे, वो fibromuscular node जैसा होता है एक, उसको हम बोलते हैं perineal body. वो भी rectum को support करती है, ठीक है. Then you have the pelvic peritoneum. जो pelvis में होता है ना peritoneum layer लाइनिंग, वो भी करती है रेक्टम को सपोर्ट. हो गई तीन. पेरिनियल बॉडी, दैट इज अ फाइब्रोमस्कुलर नोड, वो मसल्स की ब्लेंडिंग से बनता है, वो करता है सपोर्ट. पेल्विक फ्लोर जो बनता है लेवेटर एनाई से, वो करता है सपोर्ट. और पेल्विक पेरिटोनियम, पेरिटोनियम जो होता है ना पेल्विस का, वो इसको सपोर्ट करता है. हो गई ये तीन चीज़ें. देन यू हैव सर्टन इम्पॉर्टेंट सपोर्ट्स हेयर. यू हैव कहाँ गया वो, फेशिया ऑफ वॉल्डियर्स. You have fascia of Waldeus. That is the fascia. Rectum है ना, ये rectum है, ये rectum है आपका. rectum और sacrum के बीच में जो fascia है ना, उसको बोलते हैं हम fascia of Waldeus. ये एक support हो गया posteriorly. Anteriorly you have present fascia of Denonvilliers. Fascia of Denonvilliers, that is present between the rectum and seminal vesicle. ये यहाँ पे seminal vesicle होता है. That is present between the rectum and the seminal vesicle. This seminal vesicle और ये prostate, ये दिख रहा है आपको, ये prostate है, ये तो bladder है. जो पीछे से होता है वो हो गया फेशिया ऑफ वॉल्डेयर, सैक्रम और रेक्टम के बीच में. जो आगे से होता है दैट इज प्रेजेंट बिटवीन द सैक्रम एंड द प्रोस्टेट और सेमाइनल वेसिकल, दैट इज कॉल्ड एज द फेशिया ऑफ डेननविलियर्स. दीज आर अगेन टू सपोर्ट्स. ठीक है, हो गए ये दो भी सपोर्ट. Coming back to this diagram, यहाँ पे आपको होता है lateral ligament of the rectum, that you have the lateral ligament of the rectum also. So if we enumerate the supports, you have the perineal body, वो muscles की blending से एक fibromuscular node होता है जो आप further classes में पढ़ेंगे. Then you have this pelvic floor which is formed by the levator ani muscles. ठीक है. Then you have the pelvic peritoneum. इस pelvis का जो भी peritoneum होता है वो भी इसको support देता है. Then you have the lateral ligament of the rectum. Laterally जो rectum के ligament बनते हैं उसको बोलते हैं हम lateral ligament of the rectum. Then in the another diagram you can see the यहाँ पे होगा fascia of Waldeyer between the sacrum and the rectum. Then you have the fascia of Denonvilliers present between the prostate and the rectum. ठीक है. These are the various supports of the rectum. Supports के बाद what you will come across some applied aspect of the rectum. अब अगर देखिए what is this picture, your index finger is being lubricated by means of some jelly, lignocaine jelly, to just inspect the rectum of a patient. कुछ पेशेंट आपके पास कॉम्प्लिकेशंस करके आएगा तो डॉक्टर विल फर्स्ट ऑफ ऑल डू द डिजिटल पर रेक्टम एग्जामिनेशन. डिजिटल मीन्स फिंगर से पर रेक्टम via rectum examination. Digital per rectal examination introduces his index finger into the rectum and the patient is in knee chest position. ठीक है, knee chest position कि इसने इंट्रोड्यूस फिंगर. तो ये क्या क्या इस चीज़ से देख सकता है. इन मेल्स इट कैन सी द prostate का पीछे वाला posterior surface of the prostate and it can see the seminal vesicle here, fine, and vas deferens. यहाँ पे vas deferens होता है. prostate, seminal vesicle and vas deferens in case of males. in case of females यहाँ पे perineal body देख सकता है और देख सकता है cervix, यूट्रस का नीचे वाला पार्ट, दैट इज कॉल्ड एज द सर्विक्स. ठीक है, दैट इज द क्या पर रेक्टल एग्जामिनेशन पे क्या क्या पोस्टीरियरली ऑब्जर्व कर सकता है बाय मींस ऑफ फिंगर अ डॉक्टर. देन दोनों सेक्सेस में ये देखता है एनस और रेक्टम के बीच में ये जो रिंग होता है एनोरेक्टल रिंग, वो ये डॉक्टर पैल्पेट कर सकता है. एंड दिस एनोरेक्टल रिंग इज वेरी इंपॉर्टेंट बिकॉज इफ इट इज कट there is incontinence. There will be incontinence. Then after that, what else can a doctor see, palpate in this rectum? Either a growth, ठीक है, कोई कैंसर है रेक्टम का वो देख सकता है. He can see whether the patient has hemorrhoids or no, ठीक है. Moreover, any growth, any stricture, कहीं कोई ये नैरोइंग तो नहीं है, वो देख सकता है. एनलार्जमेंट ऑफ द प्रोस्टेट देख सकता है. एनलार्जमेंट ऑफ द सेमाइनल वेसिकल्स देख सकता है, ठीक है. अगर फीमेल अब होगी तो यहाँ पे यूट्रस होगा ना, तो देख सकते हैं एनलार्जमेंट ऑफ द यूट्रस मत है, ठीक है. अब इफ फीमेल इज इन पार्चुरेशन मीन्स डिलीवरी तैयार है, तो उस टाइम कैसे हम करते हैं? अगर हम उसको पर वाजाइनम एग्जामिनेशंस करेंगे और करेंगे देखने के लिए, एसेस करने के लिए कि कहाँ उसका लेबर पहुंचा, शी विल गेट इन्फेक्टेड. सो वी गो विया पर रेक्टम एग्जामिनेशन. उससे हमें पता चलता है कि उसका डिलीवरी कब हो जाएगा, when will she be in labor. After that comes your another applied aspect of the rectum, that is the proctoscopy. This instrument is called as the proctoscope. ये instrument है, इसको बोलते हैं proctoscope. This is used by the surgeons. ये introduce करते हैं इसको rectum में, फिर torch से they visualize the rectum, ठीक है. After that comes your sigmoidoscope. See, this is your rectum. This instrument is called as the sigmoidoscope. This is being introduced into the rectum, then in the sigmoid colon, to visualize the various pathologies or any other thing what you can have in the rectum or any. This picture, this is the this is the प्रोलैप्स ऑफ द रेक्टम. यहाँ पे क्या हो गया है, ये एनल कैनाल है. दिस इज द एनस. एनस से रेक्टम बाहर आया है. रेक्टम इज आउट. समटाइम्स दिस व्हाई डज दिस अकर? कहीं कहीं पेल्विस फ्लोर वीक हो जाता है, या ज़्यादा डीप होते हैं रेक्टोवेजाइकल पाउच, या फिक्सेशन ऑफ द रेक्टम परफेक्ट नहीं होती है, उसकी वजह से रेक्टम बाहर आता है. या आइदर इट विल बी पार्शियल और इट विल बी कंप्लीट एक्सपल्शन ऑफ द रेक्टम. कंप्लीट एक्सपल्शन इज कॉल्ड एज द प्रोसिडेंशिया, ठीक है. Then you can have various cancers of the rectum. rectal cancer होता है रेक्टोसिग्मोइड. अगर हम देखेंगे ये रेक्टम और सिग्मोइड के बीच में जो जंक्शन है ना, यूजुअली यहाँ पे होता है कॉन्स्ट्रिक्टिंग टाइप ऑफ ये कैंसर. कॉन्स्ट्रिक्टिंग मतलब यहाँ पे ल्यूमेन कॉन्स्ट्रिक्ट हो जाता है. अब अगर हम देखेंगे एनोरेक्टल जंक्शन पे या एम्प्यूला पे, वहाँ पे होता है प्रोलिफरेटिंग टाइप ऑफ कैंसर. वहाँ पे होता है प्रोलिफरेटिंग टाइप ऑफ कैंसर. I think that is it. Thank you.